Huntington's disease is a genetic disorder mainly affect nervous system, brain. Look at this brain images, normal and Huntington disease brain, CT findings. Introduction. Huntington's disease is a progressive neurodegenerative genetic disorder characterized by motor dysfunction, cognitive decline, and psychiatric symptoms. It is named after George Huntington, who first described the condition in 1872. HD typically manifests in mid-adulthood, though juvenile forms exist. It is a hereditary disease affecting individuals of all ethnic backgrounds. Definition. Huntington's disease is a hereditary disorder caused by mutation in the HTT gene, leading to the production of an abnormal form of the Huntington protein. This mutation results in the progressive degeneration of nerve cells in certain areas of the brain. Types. A adult onset Huntington's disease. The most common form usually appearing between age 30 to 50. Second, juvenile Huntington's disease, less common, occurring before age 20 and often presenting with different symptoms and a faster progression. Causes. HD is caused by genetic mutation in the HTT gene on chromosome 4. This mutation involves an expansion of CAG. Repeats within the gene. A normal HTT gene has up to 35 CAG repeats, while the mutation gene in HD has 36 or more repeats. The number of repeats correlates with disease severity and onset age. Risk factors. 1. Genetic. Having a parent with HD increased risk to 50%. Second, family history. The primary risk factor is a family history of the disease. Complications. 1. Motor dysfunctions, difficulty with voluntary movements, balance and coordination. Second, cognitive decline, memory loss, impaired judgment, and difficulty with complex tasks. 3. Psychiatric symptoms: depression, anxiety, irritability, and social withdrawal. 4. Nutritional deficiencies due to difficulties in eating and swallowing. 5. Increased risk of infections due to immobility and other health complications. 6. Suicide risk elevated due to psychiatric symptoms. Pathophysiology: HD involves the progressive degeneration of neurons in the striatum, a region of the brain involved in the movement control, and the cerebral cortex, which is responsible for cognitive functions. The abnormal Huntington protein aggregates in neurons, leading to cellular dysfunction and death. This neural loss results in the characteristic motor, cognitive, and psychiatric symptoms of HD. Signs and symptoms. 1. Motor symptoms: involuntary jerking or writhing movement, muscle problems, slow or abnormal eye movement, impaired gait, posture, balance. 2. Cognitive symptoms: difficulty organizing, prioritizing, or focusing on tasks, lack of impulse control, lack of awareness of one's own behaviors, abilities, difficulty in learning new information. 3. Psychiatric symptoms: depression, apathy, social withdrawal, insomnia, fatigue, suicidal thought, obsessive compulsive behaviors. Medical diagnosis: first, genetic testing, confirmatory test involving analysis of CAG, repeats in the HTT gene. Second, neurological examination, assessment of motor symptoms and cognitive function. 3. Psychiatric evaluation, screening for depression, anxiety, and other psychiatric symptoms. 4. Imaging studies, MRI, CT scan, to assess brain atrophy. Nursing diagnosis: 1. Risk for injury related to motor dysfunction and impaired coordination. 2. Impaired physical mobility related to chorea and muscle rigidity. 3. Impaired verbal communication related to cognitive decline and psychiatric symptoms. For self-care deficit related to progressive physical and cognitive impairments. 5. Imbalanced nutrition, less than body requirements related to difficulty swallowing and eating. Management and treatment. A. Pharmacological treatment. 1. Tetrabenazine. 2. Antipsychotic for psychotic symptoms. 3. Antidepressants for depression. 4. Mood stabilizers for mood swings. B. Supportive therapies, physical therapy to maintain mobility and function. 2. Occupational therapy to assist with daily activities. 3. Speech therapy to address communication difficulties and swallowing issues. 4. Psychotherapy for patients and families to manage psychiatric symptoms. C. Nutritional support, high calorie diets and feeding strategies to prevent weight loss. Psychosocial medicine. HD affect not only patients but also their families. Genetic counseling is crucial for family planning. Support groups and counseling can help families cope with the emotional and psychological impact. Legal and financial planning is also important due to the progressive nature of the disease. Prevention. Currently, there is no way to prevent HD in individuals who inherit the mutated gene. However, genetic counseling and testing can help at risk individuals make informed decision about family planning. Pre-implantation genetic diagnosis allows embryos within the mutation to be selected for implantation in families not to carry the mutation. In conclusion, Huntington's disease is a genetic disorder with profound effects on motor, cognitive and psychiatric functions. Early diagnosis through genetic testing combined with multidisciplinary approach to management can help alleviate symptoms and improve quality of life for patients and their families. Advances in research continue to seek potential treatments and ultimately a cure for this devastating condition. Thank you. Have a nice day.